Mr. Rahim, based on your experience, what advice would you have to someone who knows a person who may need help?
Yeah.
How do you persuade them that they should seek help, whether they're a family member, a friend, a student, such as the ones you talked about?
Sure. And I would say I get that question all the time. I speak at support groups like NAMI Family to Family Group, DBSA, and that's the billion-dollar question, I would say, because we can't persuade anybody to do anything that they don't want to do.
What's your approach? What do you do?
The key thing I say is education. We can't change anyone's behavior, but we can change how we respond to people. So the key thing I say is educating ourselves, and there are a lot of support groups, there are a lot of educational programs out there that if family members or people, say students, can take, and they can change the way they interact with their friends or their loved ones, and then thereby helping them understand what the loved one is going through. Because especially when I was in psychosis, nobody could tell me that I was going through psychosis. But my parents were fortunate enough to bring me to the hospital. Because they changed their way of approaching my condition, they were able to get me help.
Dr. Eaton, what's your experience? How do you persuade people who need help to seek help?
Well, I was going to say, one thing that's possible in this area is a program in high schools which would be built into the health curriculum. So there's typically a health curriculum about diseases in high schools, and you can build into that curriculum without too much trouble a module on depressive disorder, psychosis, so people are aware of these and think of them as illnesses just like any other illness. Then it becomes, that's part of the stigma reduction idea, and they become less resistant. There also are, in high schools, screening programs. So the Teen Screen program is implemented in thousands of high schools around the country, in which you screen high school students, oriented a little bit toward depressive disorder, because you mentioned suicide as being the 10th most important cause of death, but for teenagers, it's the 3rd most important cause of death. So there are programs in high schools, I guess that's what I'm saying, to make people aware of the issues around mental illness.
You were critical of the focus of NIH.
NIMH.
Well,
mental health.
The institute, the institute that deals with mental health.
Right, National Institute of Mental Health.
And our committee and the Congress has increased funding for that. And there's a bipartisan interest in doing more. If you were there, what would your focus be going forward?
Well, I'm completely supportive of more funds for mental health, justified by the burden of disease that I mentioned. The orientation has been away from we no longer can apply for grants with diagnostic categories as the outcome. It's silly. And so I would change that orientation. And I think they really, the SAMHSA is a very important agency, and I think to some extent the NIMH has dissociated itself from the public health orientation, partly because SAMHSA is there, but SAMHSA doesn't have the expertise to do the public health research that the NIMH has. So I made a comment, it wasn't here, but in the written comments. When I worked at SAMHSA for 2 days a week last year, there was no psychiatrist there, not even one psychiatrist. As I left, one psychiatrist joined the SAMHSA. There was only one epidemiologist at the National Institute of Mental Health. So that's a failure in public mental health.
Dr. Hep.